I first met Patricia a couple years ago in San Francisco for a fundraising event, and she doesn't remember me, I'm sure, but because she was so busy, surrounded by a bunch of people, and she just has a beautiful artwork. Many of you know that Patricia suffers from glaucoma, for which she has lost a fair amount of vision, and but she didn't let, she is a visually impaired individual, but she didn't let that define her. I have many artists in my own practice. 8 minutes, how much do I get to know those patients? Many of them, bring their artwork to my office. Most of the time, I'm doing the talking rather than, just as Aki showed the paper. So today, we really have the privilege to listen to Patricia. And being a visually impaired artist, she inspires people. She formed her nonprofit foundation called Inside Arts, and really promoting the visually impaired artist to showcase their artwork. So we're going to hear her from her, the diagnosis, the impact on her professional and a personal journey. Really a privilege, Patricia.
Good morning, everyone. First of all, I would like to say thank you to Elena and TGF for including me in this brilliant community. I am truly grateful to be here. And secondly, full disclosure, I want you all to know that I operate completely from the left side of my brain. So, glaucoma is not just a disease of the eye. It is an emotional disease as well. Losing vision can cause grief, real, palatable, gut-wrenching, bring you to your knees grief. I know it because I've experienced it. This disease is not simply that of the eye. It is more than that. The origin of the disease is the eye. However, it starts you down a long road of seeking knowledge, finding treatment, and praying every day for a cure. I can't tell you how many times people have come up to me and said, "You don't look blind." And quite honestly, my tongue is sore from biting it. You have to grow a thick skin upon diagnosis. You will be told many things that you don't want to hear. And it is absolutely no rhyme or reason to this disease. So you just have to take it one day at a time. 15 years ago, I was diagnosed with glaucoma. It wasn't just a surprise, it was a shock. I went into a routine eye doctor's appointment, and it turned into a lifelong diagnosis of which there is no cure. Right now, at present, I am considered stable after many surgeries and many different eye drops, which I simply couldn't tolerate. I was that one patient that just could not handle eye drops. So I did everything I could to stop the progression of this disease. I hounded my physicians. I truly did. I prayed every day for a cure. I joined online support groups. I bargained with God. I tried to make my mind see through the blind spots, and I actually did that. And I ran, sometimes literally and sometimes emotionally. A few years into my diagnosis, my vision began to rapidly decline. I was terrified. My first surgery was challenging. The recovery was very long, and I was adapting to a new way of life for me that simply was not easy. That adaptation, for me, began with awareness. I became aware of my condition, the treatment options, and the incredible complexity of the human eye, something I had taken for granted for most of my life. Now, when I wake up every morning and I can still see, I am so grateful, and I pause to give thanks for that. I'm even grateful for the journey that brought me here. 15 years ago, I never thought I would be standing here in front of you. The Glaucoma Foundation, TGF, has been an invaluable resource throughout. Their daily LinkedIn updates, live and archived webinars, and educational YouTube content are an outstanding, trusted resource in which to stay informed. To truly embrace this path, I had to stretch out of my own comfort zone and out of my own way. As a hands-on kitchen and bath designer for over 20 years, I knew that I had to pivot. It became painfully aware to me that I had to make a change in a career that I loved. As an artist my entire life, I knew that I could embrace that. However, most of my work was very detailed. And as you can see now through these paintings that are mine, I had to let go of that, and I began to take courses in abstract art. And believe me, shifting from detailed art to abstract art is not an easy leap. You're really engaging your mental facilities more so than ever because these paintings are mostly just out of my mind. I typically don't use photographic references. So I started to take these online courses, and I went into mixed media and abstract art. With half of the vision lost in my left eye and central vision in my right eye, it became very difficult to continue to do these tightly detailed drawings. Instead, I now create intuitively. I work with texture, I work with color, and larger shapes. This has opened up a whole new creative world for me. Family history of this disease was something that was never discussed. It turned out to be quite relevant for me. My grandmother and my uncle, on my mother's side, both had glaucoma. And this was something that I only discovered after my diagnosis. My mother looked visibly stricken when I told her of my condition. Lack of communication and denial are two major obstacles in glaucoma. If you have it, tell your family members. Please encourage them to get yearly comprehensive eye exams. Push for it. Even though it's uncomfortable, you need to talk about it with your family. You might just save their sight. What newly diagnosed patients don't realize is that they have the power to say no. Early on, when I was first diagnosed, I was sent to a local eye care specialist who told me that I needed emergency laser surgery without even explaining to me what glaucoma was and what laser surgery was. I said no, I refused, and I walked out of the facility and began the research on my own. That's how I found the Wilmer Eye Institute at the Johns Hopkins Hospital. There, under the care of brilliant specialists, my glaucoma was well managed for the first 5 years. Eventually, as is the nature of this disease, my eye pressures spiked into the 40s. I underwent surgery for a Barvelt shunt. Okay, that is not an easy surgery, and honestly, I was awake through the whole thing, so that was a little scary. But anyway, I did research it beforehand, and I had learned that it was a plate and a tube that is inserted surgically into the eye to reduce the pressures and to reduce the fluids around the eye that raise the pressures. Understanding the mechanisms of glaucoma has truly helped me to understand the necessity of treatment and what those treatments are. The surgery was successful, and I once again managed my glaucoma with eye drops only. However, a few years later, my eye pressures began to rise once again. I successfully underwent a trabeculectomy in both eyes. And this past year, I just had cataract surgery. And again, I am not on any drops at this point, but I know that that can change. I want to emphasize drop intolerance, a major challenge for many, especially for me. Preservatives in eye drops cause serious reactions, which ultimately led to more surgeries. Hopefully, more preservative-free eye drops will be available soon. Glaucoma is not just medical. Glaucoma is deeply emotional. Getting outside of myself and connecting with visually impaired artists from around the world has helped me immensely. The TGF support group is a great place to find community and guidance. A support system is vital to new patients with glaucoma and for patients like me who have had glaucoma for many years. I strongly suggest that you embrace it. Also, finding the support of others around you. Know who is in your front row. It is vital to have the support system as you travel along this lifelong journey. For me, continuing to create art is vital. Just recently, I have acquired a 501c3 status for a nonprofit that I have started called Insight Arts. The goal and the mission of Insight Arts is to create a community awareness of the artworks of the visually impaired artists My first solo show or show with these artists is next year in May in the town that I live in, York, Pennsylvania, and it is a 6-week curatorial show. Now, I guess maybe 4 or 5 years ago, I started doing this on the West Coast, and I really decided to create a grassroots program in galleries locally to create art for artists that are visually impaired and also have the community become involved. Hopefully, I would like to have sessions during this 6-week run to get the community involvement and to create this awareness that will hopefully result in those people that attend my shows to go and get their eye exams. I think being a part of the community is extremely important, and I think outreach to the community is also equally important. Raising awareness through art has become my passion and my purpose. I believe with all of my heart that art heals. Whether you are making art or whether you are experiencing art, art shifts perspective. It lets you explore, expand, and breathe. And I know many of you have been to a museum and you have stood in front of a painting. I believe you have. But did you realize that when you're standing in front of that painting, you're standing in the exact spot of the artist that created it? So you have that connection with the painting, even though you don't realize it. On a related note, let's talk a little bit about exercise. I've been working out for most of my life, many, many years. I was actually a bodybuilder when I was in my 30s, 40s, and 50s. I had to adjust my workouts, especially with weightlifting, upon diagnosis. Currently, I use resistance band, but I still work out and run with my dog at least 5 or 6 days a week. I am committed to that. Something else that is essential in exercise and in daily life, and I don't know if you've ever been told this, but you should always keep your head above your heart. It's a pretty simple rule of thumb, but you don't want to lower your head and increase your pressures. And in exercise, there are exercises in yoga like the downward dog and the cat-cow and the cat stretch, where your head is below your heart. And this can potentially increase your eye pressures. However, exercise is highly recommended to increase the blood flow to your eyes. This is extremely important in glaucoma to keep those eyes healthy. Many specialists have highly recommended cardiovascular exercise to me, which I try to do at least 3 or 4 times a week in addition to the resistance band. Another thing I'd like to recommend is keep up with your passions. I have had a spotted dog in my whole life for many years. My dog right now, my little Dalmatian, Millie, is number 12. So yes, I'm that crazy person that's had 12 Dalmatians. I actually trained Millie to become a therapy dog, and I am a certified handler. So Millie and I go visiting every week or so to rehabilitation centers, hospitals, nursing homes, all different types of places. And Millie actually gives comfort to the people that are around her. My favorite is we go to elementary schools, and this is so much fun. And the children sit in a circle around her, and she sits in the middle of the circle, and they take turns and read books to her. It is absolutely something that brings me joy as well as these kids. They're just wonderful, and they will tell you their life story without being prompted. So this is a huge part of getting outside of yourself, is doing something for others. I think this is extremely important to your mental and your emotional health as you travel through this disease. Another thing that was recommended to me, and it is a difficult thing, is meditation, daily meditation. Meditation is called a practice because you do actually have to practice it. I often follow guided meditations online. David G is one that I like a lot. He's on YouTube. And there's another option called Insight Timer, where you can actually manage how much time you want to meditate. Now, I have been advised, and there have been studies done, that you should meditate 20 to 30 minutes a day, which is difficult, even though it doesn't seem like that much time, because it actually reduces the fight or flight part of the brain called the amygdala, and it helps you cope better. And I have read studies that it might even help manage glaucoma. So I will let you know after my next appointment to see if this really does help. A few practical tips for the newly diagnosed patients out there. Bring someone to the appointment with you, maybe for the first couple of times. You're going to get a lot of information coming at you that is all new to you. Your doctors have said these terms and told patients over and over again what's going on, but this is new to you. So bring someone with you. This is extremely important. And if you can't bring some with you, perhaps ask your doctor if you can FaceTime someone in and get a printout of your summary. Ask for definitions of unfamiliar terms. And for the physicians here, I would like to ask that you give special attention to those newly diagnosed. While I am certain that you do, please be sensitive to the fact that this is a very, very scary disease. It truly is. Glaucoma is not just about vision loss. It's about loss of independence and fear of the unknown. Believe me, I have been there. Little tip here. I asked the doctor this morning if she could please help me walk across the stage. 15 years ago, I could have skipped across that stage. But now with vision loss, I have to ask for help. And as for someone who for most of my life has been told that I am too independent, it's very difficult for me to ask for that help. So glaucoma can be a teacher as well. You need to reach out to others and ask for help. And please don't be afraid to do that, because more than likely they will be willing to step in and give you a hand, as you did. Thank you. So, something I need to add to the mix here as well, which I try to adhere to as much as I can, is diet. The Mediterranean diet, there have been studies shown that it really can help you manage your glaucoma. Green leafy vegetables such as spinach or kale, cruciferous vegetables have all been known for reducing inflammation. So guess what? Your mother was right. As it is the season for strawberries, I've been having a spinach salad with strawberries a few times a week. I had one yesterday, it was delicious and nutritious. Bananas, avocados, pumpkin seeds, and black beans are an excellent source of magnesium. Early studies have indicated that dietary magnesium supports eye health by enhancing blood flow to the eyes. Magnesium also helps protect the retinal ganglion cells. One tip for magnesium, though, it's best if you take it at night because it can actually help you sleep better. Fatty acids, you all know this, such as omega-3s found in fish, such as salmon, tuna, sardines, and halibut, are good for the eyes. But please be aware that tuna contains mercury, and it has been suggested that you should only eat tuna once a month to reduce your intake of mercury. Coffee. In moderation, it's perfectly fine. I had a half a cup of coffee this morning and my hands are still shaking. Clearly, I no longer drink coffee. I tend to drink chai tea or ginger tea, which ginger tea has been proven to help against inflammation as well. There are some really great books out there for the newly diagnosed patients. These books are also available on Audible or Kindle. With my vision loss, I can actually no longer read a book, which has been very difficult for me, but I had to transition into using Audible books and not falling asleep while I was listening to them. But I have learned to do that, and I probably read 2 or 3 books a month now at this point. But it is a shift again. And these books include What Your Doctor May Not Tell You About Glaucoma by Dr. Gregory Harmon and Nancy Intrator, The Glaucoma Guidebook by Dr. Constance Okecki, and Glaucoma, What Every Patient Should Know by Dr. Harry Quigley and Dr. Mona Kareem of the Wilmer Eye Institute. I have seen such advances in treatments and surgeries since my diagnosis, including eye drops. 2 of those eye drops that are new, relatively new to the market, are Vyzulta and Repressa. I did very well on Vyzulta. Patients, please know that you can go to the website that these eye drops are on and download coupons and use them to help offset the high costs of these medications. Innovative treatment like MIGS, minimally invasive glaucoma surgery, are making a big difference in drug delivery system. Some of those include Durista, the iDose, and the iStent Infinite, which I heard pros and cons about yesterday, so I'm not really going to go into that. Your physician is the one that can best help you decide which is the right treatment for you. Assistive technologies for low vision are also improving. Recently, I tested out the new Ray-Ban Meta AI glasses. So we're on AI today, so let's talk about them. They're really cool. Actually, they were on sale last week, so they're now under $300, but they sell out really, really quickly. They're equipped with cameras in the front, and then you have audio inside of the arm of the glasses. And you ask it, hey, Meta, show me where the doorknob is. Hey, Meta, show me where the curb is. And it tells you. And it's crazy. I mean, I asked it where the doorknob was. It says, put your hand out to the right and lower it down a couple of inches, reach to your right and move forward. And you could find it. Now, I have lost depth perception from glaucoma, which is why I needed help. And it'll tell you where a curb is. I walked to the edge of a staircase and said, hey, Meta, tell me where the stairs are. And they said, step another foot in front of you, reach your toe out, tap. And I was able to locate the stair without even really actually physically knowing where that stair was. So this is a pretty huge thing. And interesting enough, it was introduced to the public as something for the Instagram community, the influencers. This is who these glasses were for. And the blind people in the blind community stepped up and said, hey, what about us? So there's a whole new market out there where people can actually utilize these glasses. And I also plan on investing in a home tonometer, hopefully next month. Home tonometers, I think, are an interesting way to personalize your glaucoma treatment. They will take your pressures any time of day or night. You do it yourself at home, and it can send it to your doctor, or it can keep a record of your pressures for yourself. You can go through it and see where your pressures rise and fall over the course of the day, so that you can get a better handle on your pressures and your median range, and you can be able to really move forward with treatment knowing what your target range is. It took me a long time to figure that out. Mine is 12. Anything above 12, I begin to lose vision. So that's why this is very important, and having a home tonometer and taking control of things that are out of your control can be very helpful in managing glaucoma. Of course, the ongoing research is bringing us ever closer to a cure. The Glaucoma Foundation is on the forefront of this, supporting breakthroughs that offer real hope. So here's what I know. Glaucoma may have taken a part of my sight, but it has not taken my vision for life, for art, for connection, and for purpose. It's okay to grieve. It's okay to feel overwhelmed, but don't stop there. Surround yourself with people who understand. Find your outlet, give back, advocate, and never, ever give up. Each day that you can still see is a gift, and what you do with it is entirely up to you. Keep doing what you love. Don't stop. Keep showing up. Keep shining your light, because no matter how dim the world seems, we, even in darkness, still can create beauty. Thank you very much.